Dixie Regional Medical Center began operating at full capacity in both its hospital and ICU unit last week. While generally only about 55 to 60 patients are there for COVID-19, hospital staff is being pushed beyond their limits during this pandemic.
And we've been operating at roughly 150% ICU capacity for the last 10 days. We did our ICU census did drop a little bit in the last 24 hours, and that makes me very sad. Part of the reason that our ICU census has decreased is in the past 24 hours, as a hospital, we experienced four patient deaths from COVID.
As a result, nurses from other Intermountain facilities are coming to help Dixie Regional.
We have nurses from Intermountain Medical Center and from Primary Children's coming and helping us out. Some of them are already here, some of them are still coming.
Currently operating in contingency care, the ICU expanded its typical 32 beds into another wing of the hospital.
As we've now gone into another wing of the hospital, which doesn't normally take care of ICU patients. The challenge with doing that is there's space right now to house the patients, but the challenge comes in offering nurses, respiratory therapists, and doctors to take care of them.
Not only are nurses working round the clock and taking on extra patients to meet the needs, but doctors have joined in to make sure that critical care is monitored.
Typical day in our ICU, we've got 2 or 3 doctors that are spending time there seeing patients. Today in particular, we had 7 doctors that were seeing patients. Not all of them staying the entire day, but nonetheless, a doubling, nearly tripling of the workforce required to take care of these patients.
Last Friday, the hospital capacity also reached 100% of its 284 licensed beds. This forced the hospital to make a decision to shut down elective surgeries this week.
As a result of that, we had to make the difficult decision of postponing once again any elective inpatient surgeries for this week. And so currently that's what is happening. We're continuing with urgent and emergent surgeries, even those that will require an inpatient bed, but we have postponed elective surgeries that require a hospital bed.
The shutdown will then be evaluated to see if it may need to be ongoing. The hospital medical director said if the increases continue, they may even have to expand into the Blue Med tent, which sits just outside the back door of the hospital, as shown on an Intermountain video.
You can see here we've set up a tent in order to have additional beds, and we don't want to use this space. We can if we need to, we will if we need to. We're prepared to take care of all patients in Southwest Utah, but we would like to stay as far away from crisis care as we're able to stay.
With the holiday season upon us, the hospital staff is asking for the gift of being safe.
And as much as I'd like to say things will be different at Christmas time, the reality is Christmas is 2.5 weeks away. And I think we see already that Christmas time will not be different. And truthfully, New Year's Eve will probably not be different.
We're heading into a very busy time of year where it's so common for us to gather together. And we as the ICU caregivers would plead with you to please be careful.
In St. George, Melissa Anderson, Community Education News.